Hi friends, let me introduce to you Dr. Karishma Chandra. She is a DAMS regular course student. She is a graduate from Tver Medical University, Russia, and she has passed her MCI screening exam with a score of 168 this time. So Karishma, how are you feeling today?
Amazing, relieved, and I think I can move on forward because I was stuck here, and it was a very important step in our career, so very relieved.
And I'm sure the relief is the primary feeling that you get after passing MCI screening, because it is like qualifying exam. Till the time you pass it, you're stuck somewhere.
Yes.
You need to pass.
Yes, the validity you need, right? Like recognition, because your degree is not valid here. So for working and to make the 6 years of torture worth, so it's very important to get the recognition here in India.
Let me, may I ask you here only, you were talking about how tough it is. So I'm sure it must have been stressful.
A lot, like.
So how do you manage that?
So luckily, I won't lie or I won't brag much, but difficulty and I used to talk regarding my emotions, my anxiety issues, because I have more problems of anxiety than the study problems. So I used to talk to some teachers like how I'm feeling stuck, I'm feeling lost, which most of the students feel, like in 1 week, 2 weeks, they feel lost, like how to prepare, from where to begin, how much have I done. So I used to discuss and stay in touch regularly.
So do you think the teachers played a role not only in the academic part, also in the motivating part?
I totally believe, because but I experienced it here that teachers do respond in this way also, because mostly it's not there. Teachers only find the responsibility towards studies, but here there is a whole unit, there are people who will continuously stay in touch with you to discuss the issues regarding whatever, like your preparation, regarding studies, regarding your emotions, your behavioral changes and all, because there's a lot of stress, like especially in the end time. So definitely we need someone to discuss, to talk about.
How was your experience with the regular classroom program and the academics in DAMS?
I think it was very much needed, because before I tried one institute, it didn't work for me. So then I decided with the recommendation of one doctor, I decided to join DAMS, and luckily I cleared it.
Were you happy with the differences that we have as compared to the other people?
I felt so because the pattern of exam is getting changed. So what I see is not every institute is working upon it. So pictorial questions are coming, the question pattern is getting changed. You cannot rely on the old books, just throw them off. They are not of any use now. So you must attend the mock test, because recent questions the teachers put here, they put a lot of effort in making the test. It's not like copied from some books, like directly the questions. They do not put like that. Teachers do spend time here to put the questions there, like recent question which can come, So that works a lot. Mock test works.
So what was your approach during the classroom? Like when you were attending the class, would you make notes, or would you concentrate in understanding, or would you go home and read? What was your strategy in the exam?
I threw my old notes first. Before I threw old notes. I was the first bencher. I used to start sit on the front row. So I was the talkative one. I used to ask a lot of questions for the teacher. I need advice. So it was really nice. They entertain every question, every silly question I ask. So I was very comfortable. Difficulty is not very rude or something, like what have you asked, or they will insult you or something. So I was very comfortable. And the batch was also not too large, it's like from mic something is going on, so you can connect to the teacher. So
plus I feel the majority of learning that happens in this sector is in the classroom itself. So when you are totally understanding what the teachers are saying, you are interacting, you are answering,
exactly.
Your learning also becomes better. Like what I've seen, and plus teachers also, get that biofeedback from students. If a student is, nodding his head or not saying, so we also get an idea, okay, they're understanding or they are not understanding. And you see, good teachers will repeat also. If they don't see people nodding their heads, they will repeat and say it again. So that is, the beauty of a student-teacher relationship.
Yes.
And so I believe the classroom is the key thing.
It is indeed. Whatever it is, if you have attended coaching before, still sit in the class, listen to what they are saying. It will get repeated, it will get revised one more time. I mean, it will polish your concepts. It's not like it's gonna reduce something out of your brain, so it will improve definitely. So sit in the class, listen to, don't sit at home and stay lost in big bulky books. So you must interact with the teacher and stay in connection.
And I feel, when you are sitting alone, you'll end up attracting negativity. It's better to come to a classroom, meet people, you get up, you get dressed, you go to a classroom, you interact with teachers, you get some positivity, you go back, study, revise your notes, and then, give tests. So what was your, approach towards the testing system that we do and the CBT that we conducted in the end?
Test is must. I did not do any books like MCQ books. So what I did was, like, I used to study the notes and used to appear in test. So those questions only I did. So and then discussion, test and discussion. So discussion used to happen. So in discussion I used to get like a gist of notes, all the notes, because the teachers used to try to cover all the topics, in that discussion. It's not all about the question paper they discuss. So I think test series you can join, because it will help you. Because जो old books हैं MCQs की, उस पे अब I think rely नहीं किया जा सकता है, क्योंकि pattern काफी change हो गया है. New questions.
That brings me to my next question also, that you appeared for this MCA scanning exam. What was this paper all about? Like, when you were giving the exam and now when you come out, you passed this exam. What did you feel the exam was like? You saw there were visual questions in the exam.
A lot.
There were some clinical questions as well, like, which was unlike what the popular guidebook would make you believe.
Okay, so this time's paper was all about one-liners and pictorial, image-based questions. So clinical part, which is the second part, it was a bit more difficult than the last time. But the first part, the non-clinical one, had many one-liner questions, which you can make them correct easily if you know the exact answer. Otherwise, you will mark them wrong. So they were easy, a lot easy scoring thing.
I think this time paper 1 was the more scoring.
Very
thing,
easy, very easy paper. First one was very easy, but the second one was a bit harder than before. Not too much.
And you had this time a new pattern of questions in the exam, where they had questions where more than one answer could have been correct, like A is correct, A plus B is correct. So and that was tricky, and that was the first time I think they have introduced such a system in the exam. What was your approach to that?
Such questions I find the most difficult.
Yeah. Because
it just looks like one question, but it contains 4 or 5 questions.
Yeah.
Because you have to combine the answers and then mark one answer. So I think you need very deep concept for it.
Clear understanding is required. Otherwise, you will do them wrong. And if they are like around 10 questions such an exam, and if you do not have clear understanding, you will lose all 10 of those marks.
Exactly. So you have to work upon the one-liners also, but for concept, especially for the second part of exam, you must need to polish your concepts, which you can't mug up actually.
Any particular teachers in DAMS that you remember at this time?
My favorite.
So kind of you.
Tver sir, it's kind of fan moment right now for me, sitting right beside you. Your aura is
my honor. It's my honor.
Your aura is so strong that the person gets numb totally.
Yeah, I'm so humbled. And any other people that you remember?
Gaurav sir, surgery. Gaurav sir, he is such a help. He's very humble, and the speciality is he responds to any question at any time. Like, he gets time out to reply you, and that's what we need, you know. We stay so stressed and we just send our problems to everybody, every teacher, and we expect them to reply right at that moment. So he was very helpful.
Yeah, and I think his forte is patience that he has. He's very patient with doubts.
Very patient,
yes, yeah.
very peaceful, very calm.
Yeah.
And I mean, he only, you know, gives you positivity about the exam. He's like, chill, relax, and do it calmly in your way. So that was very, very different than other teachers.
Were you happy with the way teachers were responding to you in their doubts? Whenever you asked them a doubt, they were answering?
I was actually there's a WhatsApp group, obviously, of DAMS. So there we all students used to put our problems, any problem, like whatever we are studying, and we used to tag our teacher's name, and then they used to answer us or explain us whatever it was. I used to text them personally also, but like in group, like whosoever gets something new to know, they share it, and it was very useful because it's a actually a active group which works. So
I think there is like a team learning together, you know, all
that
these
is the key, sir. I must tell you that the group discussion was the key that I cleared this time.
Yeah. And it is always a good idea to have a you know a like-minded group of people to study together also. So that also helps, I think. You know, if you have 2-3 friends who are studying together, maybe discussing, and then a faculty to help you to polish off the doubts. So because whenever you are discussing amongst yourself, you will be able to teach each other, but there will be still doubts remaining, and then you ask a teacher, that polishes off everything.
Yes.
And that has been an approach of learning, I think, which has been recommended world over, where you learn together as a team, then but you have a mentor to polish off things so that you go to the next level also. It's a very good thought that you've given us. I also want to now know from you, like, you have had a tough time in the college. You came back, then you found the exam tough, you came back, so this was a long drawn battle. Now when you come back out of it victorious after a high score here, now what would you like to advise your other students who are studying abroad right now? Many of them would be listening to your interview today in YouTube, so some of them would be maybe in China, Russia. What would you want them to do right now on how to approach life, how to approach MCI screening? What do you want to tell them? It is not a easy life for them also, because they are always worried what would be MCI screening all about, why other people are not passing. Do you want to tell them something?
As we all know that MCI result positive percentage does not stay too high, like it stays. Last time it was 25%, this time it is, till now it is 10%, I guess. So there people do freak out that how are we gonna do it, and what most of us do is do not study at all. We think that after going back to India, we have to study anyhow. Let's have fun here. Let's enjoy. Let's chill. Let's party. But guys, if you don't want to lag too much and waste this period and don't want to struggle this much, please start studying slowly. At least I think after 4th year, you must start preparing. After 4th year, because from the study burden gets down a bit there from 4th year, what I felt. And in 6th year you have a lot of time, so in vacations you must come and get the classes done, and you must get the notes with you, and you can take them back to Russia or China or wheresoever you live, and there you can revise those subjects, and there you will be having less burden when you come back to India. So that will help you a lot, because you will be having less subjects to do here in India. So you'll be covering all the subjects in these 4 months, and then in very first attempt you have maximum chances to clear it and make it happen.
And for the benefit of listeners that are listening to us today, for students who are studying abroad, who are in various places in China, Ukraine, Russia, DAMS has taken a few initiatives. Now one that we are doing is we already are running classes in various universities abroad, where our teachers are actually going there to teach. And we will be happy to hear from you if you have maybe a place, or you have in your college you want us to come and orient you, do write to me or to MCI screening cell of DAMS. We'll be happy to listen to you and try to formulate a way. We are also running various vacation courses where you can come back whenever you are having a vacation and you have significant vacations during MBBS. And you can utilize that period, like she was saying, in India in our classes, and go back with those notes.
Exactly.
And third, we have started is on eMedicos app. Now we have a distant learning program where you can actually access the lectures for MCI screening on the app itself. So this is I feel it is our duty to help students who are studying abroad and to help them crack this barrier of MCI screening. And I sincerely believe with quality teaching and sincere hard work on the part of the students, it is possible to do it 100% of the time. And there's no reason for a bad result if you put in sincere hard work. We put in quality inputs of teaching and mentoring. There's definitely, it is possible to do it every time. There should be no reason that you're not passing. But I want to add to it, do give the tests. It is very important. Yes. We conduct with a lot of effort. We have conducted a computer-based test in our computer centers, yes, where all over India we got students to come to the computer centers for MCI screening. To the best of my knowledge, that is the only simulated CBT for MCI screening. Please do take that opportunity also to give the mock test before you give the real exam.
Yes.
Otherwise, you will end up making silly mistakes in the real exam, and those will cost you a period of 6 months maybe. So here we have with us Dr. Karishma. She has 168 score in MCI screening this time, which is a fabulous result. Now I want you to say something motivating to future aspirants and something motivating to people who have not done well in this exam.
Okay.
You've been in that.
I have been before. In every zone. So. Yes.
So, like somebody who's not done well in this exam and, he or she's feeling negative, or, what would you advise them, like how to come out of it? How did you come out of it after your previous results?
Okay. So, firstly, I want to say something, advise something for the first timers, the freshers. So, in whatever course you are studying, start preparing before you come to India. Start getting the notes, coachings and vacations. And give tests if you're getting from the seniors. If something, do tests, practice the recent questions, the latest questions, not the old MCQ books. Okay, and then you can clear in the first attempt. Then, okay, I have experienced it. I have experienced the 140s thing, and that is very depressing. Trust me, that is very difficult, because you lose the vision of your preparation, that where you're heading to, So, but what we do, the biggest mistake, we take a gap in preparing for the next attempt when you get failed. We stay depressed, or we drink alcohol, or we party, or we waste time somehow. We think sometimes we think like we have studied once, we have to just revise. So no, don't do this. Just start sooner the better, you start earlier preparing for the next attempt. So the total period will be enough for you to study all the subjects. Okay, so do not take it for granted that next time you will make it happen, or do not be so depressed that you are not gonna make it happen ever. So both the things are important.
Once you have not done well, I think being overconfident would harm you. Being underconfident also would harm you.
Both things.
You have to somehow,
stay balanced.
Come out of it. You say, okay, whatever has happened, accept it, and learn from your mistakes, get back on track. I would like to add a line here that anybody who is repeating, classroom plays a much bigger role for you. Like when you are repeating, please don't lock yourself into a library and say that I am going to do self-study all alone. It would not work. When you are repeating, you need a constant touch with teachers, constant motivation. I think, and at that time the classroom becomes even more significant. So don't do that mistake. I've seen many people do that mistake, that when they are repeating, okay, they have already done the class, but I have gotten a 140 score. Now I'm going to sit at my home and study. And what will happen at your home? You will not be able to bring out that kind of output that you are able to do in a classroom program.
Exactly. It will get lower only, because you will not be able to estimate that till what level have you prepared. You have to measure the preparation level, you have to test it. And secondly, you have to stay enthusiastic 24 hours. You cannot waste a single day. So for enthusiasm, you must stay connected to the co-students and the faculty. So you will stay enthusiastic constantly, then you will be motivated, that I can do it. Alone you will get depressed.
I think the entire classroom gives you the energy, plus the teachers,
Yes.
you talk to them, and plus everything is brushed up. The academic part gets brushed up.
Yeah, when you
faster.
see some other students doing something, studying something, then you yourself feel like, yeah, I should study, I should study harder. The person is doing so good, I should also do it. So that pushes you.
With this note, I would also like to take this opportunity to congratulate you on your achievement.
Thank
I
you so
would like
much,
to
sir.
congratulate you, your family members. I'm sure they all, our parents, everybody must be very proud of your achievement today.
Yes.
Everybody would be relieved.
Very much.
Yes. And I would like to take this opportunity to wish you all the best for your future. I'm sure you will do well in life in future and rise and shine. I wish you all the best.
Thank you so much,
Congratulations.
sir.
Congratulations.
Thank you.